Thanks, everybody, for coming back. And we're going to talk about supply shifters in this segment of Chapter 3. This will be the fifth installment of Chapter 3 as far as segments go. In the last segment, we talked about the upward sloping supply curve. The higher the price, the more quantity providers or sellers, producers, whatever terminology you want to use, are willing to provide. So that's your upward sloping supply curve. Shifts in the supply curve typically happen, it's upward sloping. So if there's an increase in supply, the curve tends to shift downward to the right. If there's a decrease in supply, the curve tends to shift upward and to the left. And if you remember on the demand curve, it was shifting right and left also. Supply curve shifting right and left. So both the supply and the demand curve, as there are increases in the demand curve and the supply curve, they will both shift to the right. It's just this way for demand, this way for supply. And if there are decreases, they'll both shift to the left. Downward and to the left on demand, upward and to the left on supply. And these shifts in the curves will impact not only the prices of quantities either consumed or supplied, but also the prices of quantities consumed or supplied. So let's jump in. We'll talk about as far as a supply shifter. And when we talk about supply shifters, it was similar to demand shifters. We've held these constant when we're looking at the base supply and demand model. But we've held them constant to draw both the demand curve and the supply curve and the supply demand model. But as we look at shifts in both demand and supply, we're starting to relax or starting to look at these supply shifters and see what could impact shifts in the supply and demand by allowing these shifters to actually move and impact our decision-making process. Remember, economics is all about choice, all about decision-making, and these types of shifters are definitely going to impact the choices that not only consumers make, but also the suppliers make. The first one we're going to talk about is just the cost of the inputs. And the authors kind of break down the inputs and kind of the basic inputs into two sections. They talk about labor, they talk about capital supplies, financial capital, they talk about natural resources, and then they kind of shift technology and entrepreneurship kind of as a second shifter. And that's kind of the way. I certainly don't have a process with that or a problem with that. To me, it's you could roll them all into one and talk about them as a shifter, or you can continue to keep them apart as when you're talking about shifters. But so we'll just talk about the cost of inputs, the factors of production. We're looking at labor, we're looking at capital stock, financial capital, and we're looking at natural resources. So basically what happens as inputs increase, or the cost of inputs increase, production entities or sellers are typically, as the costs go up, they tend to be willing to supply fewer and fewer unless there's an offset in price to keep profit at a level and earnings per share at a level where it needs to be. So inputs increase, typically the supply decreases. As the cost of inputs decrease, the supply increases, and that's because producers are willing to provide more at that level because they know that they can make more profit by providing goods and services to sell. And we'll kind of talk for just a few minutes about, let's just talk about healthcare. That seems to be, and then we'll kind of, talk about some other markets. But healthcare, we'll use Meharry in this instance. So right across the street from Fisk, Meharry got medical center providing goods and services to commercial populations, Medicare Advantage, Medicaid, indigent populations, private insurers. So goods and services to a lot of different individuals across their consuming population. But Meharry, and they're going to be faced with the same issues that Vanderbilt Medical Center, St. Thomas, all the hospitals in that Nashville market are going to be faced with as they provide goods and services to that consumer population. What's going to be the impact of labor? Labor is a huge determinant. If there's a shortage of nurses, it's going to cost all of the medical centers additional money to hire nurses to provide health care to that consuming population. Likewise, technologists, on-staff doctors. What Meharry faces that some of the others may not face is when it comes to basically the natural resources. Meharry, there's not a lot of room to expand there for Meharry. If you drive around Nashville, you see some of these other hospitals, constantly building wings. They may go off into another area of Nashville and build satellite clinics that'll build emergency rooms, that'll build even smaller, kind of like lesser resource-based acute care facilities, and then feed into the larger ones. But Meharry appears, from what I can see, to be fairly constrained when it comes to land as far as a natural resource. They may be fairly constrained when it comes to their capital stock. Do they have the opportunity within that bricks and mortar that is Meharry Medical Center? Do they have the capability of changing the capital stock that they have in place? One thing that impacts a lot of healthcare providers, not just hospitals, but individual docs or medical groups or multi-specialty practices, is the price side of the equation. Most of those contracts are written on an annual basis. So they contract with the health plan and their providers agree to a particular set of prices for the goods and services that they provide. And then those prices are locked in from January the 1st to December the 31st of the next year. Sometimes they actually negotiate, because the negotiation between health plans and healthcare providers can get extremely confrontational. Let's put it that way. If you have to do it year over year, so sometimes you will see these contracts written on a 3 or 5 year basis with some price escalators built in to keep. So they can take those resources of negotiating those contracts and putting to better use or more efficient use. And again, opportunity cost when you're looking at it from a healthcare provider. And so it's even that the not-for-profit organizations, which I'm assuming Meharry is a not-for-profit. A lot of hospitals are, so I'm assuming Meharry is a not-for-profit organization. While they aren't maximizing profits, they want to make enough revenue that's going to cover their costs, plus some additional revenue that they can use to ensure that they're going to be able to improve goods and services moving forward. So that's the way that not only Meharry looks at it, but I work for a not-for-profit health plan, again, in Buffalo, New York, and it was the same situation. We were looking at the inputs to the production process, and our production process was more management type goods and services. But again, we were concerned with capital, whether financial capital or capital stock. We were concerned about the labor, because the labor market in Buffalo was really aggressive, and it was difficult at best to maintain control over the cost of labor. And then also the natural resources. While Blue Cross Blue Shield could have some satellite clinics, some satellite law, or some satellite doctors' offices where the physicians were actually employed by the health plan and some things like that. It was really difficult to control those factors of production. And then if you're on the health plan side of the process, even if you're a not-for-profit health plan, you need to make enough money to keep the doors open and have some reserves set aside so that you can ensure that you're going to be viable for the future. And what typically happens with a health plan is as the cost of production goes up, they typically pass it on to the employer groups, pass it on to those government programs, pass it on to individual healthcare purchasers of goods and services. So it makes things really difficult from just the cost of input side of the process. And so you've got the not-for-profit, and then you've got the for-profit, especially the for-profit on the health plan side. So if you're United, you're Aetna, you're Cigna, you've got shareholders that you have to satisfy, earnings per share, capital appreciation in the value of the stock, dividend payouts. So everybody in the healthcare environment, as you would be, whether you're in the restaurant business, whether you're a coffee shop business, you've got a construction company, everybody on the provider, everybody on the side of the supplier is concerned about that profit margin, concerned about making enough dollars so that they can ensure their viability going forward. And then the second kind of supply shifter. So and let's go back to the first one. So if the cost of those goods and services get too far out of balance with the profit margin, that's going to cause a decrease in the supply. If they're in good shape and for some reason labor goes down or some reason cost of other factors of production goes down, then the supply curve is going to shift. It's going to shift to the right. It's going to come down this way to the right, and that's going to imply a increase in supply. If they get out of whack and it becomes too unprofitable to provide services, then that supply curve is going to shift and it's going to come back in this direction. And again, whether it goes downward to the right or upward to the left, it's going to impact both price and quantities in our model. Technology, they talk about technology, and basically it's, as we've said before, it's the technology, it's a process that turns inputs into outputs. It's just as simple as that. And as technology increases, and again, technology in the production process increases, you're going to have an increase in supply, because as technology increases, you become more efficient. The cost of providing that good and service decreases, and you're willing to supply more at any given price. Not only supply more goods and services, and that's going to actually take that supply curve and shift it over here to the right, and that's an increase in supply. If the impact of technology goes down, then you're also going to see a shift backward to the left in that supply curve, because as technology goes down, it becomes more and more cost inefficient to produce those goods and services, and providers are not willing to sell goods and services at a loss. So that's basically the impact of technology. Now one thing that as far as technology and impacting the supply process, governments, both state and federal in the United States, can enact legislation that can at some point, and we'll kind of get into it in chapter 4, I think, that can impact technology and how much technology that you can actually implement. So just keep in mind that as we kind of go along, we'll talk about some things with technology where the government's actually inhibiting it. Then I guess in this case, the third one is returns from alternative activities. So again, opportunity cost. What is the next best alternative from a producer, from a supplier's perspective? What's the next best alternative to use their factors, their inputs of production? And they throw out several examples in the textbook. The one I'm most familiar with, and because I grew up on, on a dairy farm and intimately was intimately involved in just the production process from an agricultural perspective, is they talk about corn and wheat. So you've got 500 acres of land. You can either, plant corn, you can sow wheat. Farmers are looking at the factors of production. You're talking about, tractors, you're talking about other machinery, you're talking about labor, you're talking about fertilizer, you're talking about the seed itself. But most importantly, they're looking at the future price. So they may be on some of the future exchanges looking at, what's the price of corn. So we're sitting here in February, they're looking at what's the price of corn going to be in October, or what's the price of wheat going to be in October, and they're going to make those decisions on which one to plant. And basically, they're trying to set expectations on future prices compared to what the inputs of production that they have locked in at any given time. And so that makes the determination on whether they're going to plant corn or they're going to sow wheat. Likewise, you can go back to the Meharry example. Meharry has multiple what you would typically call service lines within the medical center. They can provide, orthopedic services, labor and delivery, cardiovascular, physical therapy, alcohol abuse, drug abuse. There's a lot of different service lines they can provide, and they are constantly looking at which of those service lines are going to be the most beneficial to their consuming population and the most profitable to them going forward. So they're always looking at alternatives, always looking at alternative activities, and more importantly, they're looking at the opportunity cost. From a monetary perspective, what's the best opportunity for using the financial capital and also the capital stock that they already have invested in at a given particular time. Another one is seller expectations. What are the future market conditions? Futures, options markets for financials, commodities. You've got, they talk about storage for goods and services. Years ago, the bourbon market, especially in the state of Kentucky, was kind of in a downturn, and they were having trouble making a profit and then selling their bottles of bourbon at a price that they can make a profit and sustain, and with sustainability. And part of that issue is you have to store the bourbon, so you're buying wheat, corn, rye, turning it into bourbon. And then you're having to store it so it ages, and the longer the bourbon stores and ages, the higher the price you can get for that bourbon. But they were having trouble with excess supply, and then all of a sudden they got this boom in demand that helped turn profit around, because you were having just a significant amount of bourbon going to Pacific Rim countries, to East Asia, to Australia. And now you've gone through that, but and it's actually improved the product, or improved the ability to improve the product of generating bourbon. And it's not only that, but it's improved profitability. You also have the same issue with wine, because a lot of wine, especially red wines, are set back for or what they call laid down for many years. Champagne the same way, and it's kind of the maturation process of that particular commodity. But what you're seeing now in Napa and some of the other wine producing areas, not only in the United States but across the world, is they are trying to produce wine that doesn't have to lay down, it doesn't have to age for as long. So you're seeing Cabernets out there on the market, it's 2023 now. You're seeing Cabernets that, with the 2020 date on them, which that's really young for a Cabernet, but still, that's what the consumers want, and that's what the suppliers are starting to move to. So you're talking about seller expectations, and it's really significant on the supply side. And then you've got got two more shifters on the supply side. You've got, natural events, storms, hurricanes, tornadoes, the flooding that, we're seeing on the West Coast. We saw it this past, winter and spring. That impacts everything. You have a hailstorm moves through corn producing areas in the Midwest and, just strips the corn and runs the crop. Those are kind of natural disasters that are going to take and rather than increasing the supply, it's going to decrease, and that supply curve is going to move upward and to the left because this natural disaster has decreased the overall supply for that commodity, and it's going to, again, impact the price and the quantity of that commodity. So you see that quite a bit. COVID. Think of the issues we had with, with supply, and the shift to the left of the supply cycle during COVID, and there's still impacts of that shift in supply side. You see it a lot in computers, you see it a lot in, mobile phones, you see it in appliances, automobile, and it's a supply chain, it's a logistic issue, but a lot of the factors that, COVID generated or COVID instigated have actually caused that supply curve for a lot of these commodities to shift upward to the left. So natural events shift upward to the left because it decreases supply. The impact of COVID, which I don't know whether you call that a natural event or not, but it's definitely an event that has caused that supply curve to shift. And one of the other issues that you see with COVID is there is a real concern in certain areas of the world that you're going to have, maybe not immediately, but you're going to have a reduction in population based on the age and, sex demographics of those individuals that, that perished or lost their lives due to COVID in certain areas of the world. In those areas of the world, let's say Africa, let's say in places of India and China, where a lot of goods and services, especially on the agricultural side, are generated by manual labor. And what most economists feel is that to continue or to try to bring that supplier to cause or to help mitigate the reduction in supply of some of those agricultural goods and services going forward, or these nations are going to have to go back. They're going to have to start automating. They're going to have to bring in more machinery to offset the lack of labor, especially in those labor-intensive agricultural commodities. The last thing we're going to talk about is just the number of sellers. As the number of sellers, enter the market, that's going to increase supply. So you get more sellers into the market. So the number of sellers increase, the supply of that commodity is going to increase. If you have a number of sellers leave the market for whatever reason, then you're going to have a decrease in that supply curve. So again, what we're talking about on these supply shifters are any kind of a shifter that's going to shift the curve downward to the right, which indicates an increase in supply, are going to shift the curve upward to the left, which is going to indicate a decrease in supply. And ultimately, it's going to impact the price and quantities of any good and service that is impacted by that shift in supply. One thing that most people don't think about, but you do see it in healthcare, is when you're talking about numbers of goods and sellers, you're not just talking about the number of individuals, producing a cup of coffee, the number of sellers producing automobiles. If you think about healthcare, you're talking about the number of individuals that are willing to move into an area like Appalachia. So East Kentucky, East Tennessee, kind of the western part of the Carolinas, even kind of northern Georgia. You have healthcare. If you have healthcare providers, if they are reluctant to move into those areas simply because their families don't want to move, they think they can make more money in Atlanta and Nashville, so they don't want to move into the rural areas, then what's that going to do to that supply curve? It's going to cause that supply curve to decrease and move upward because you don't have any young physicians that are willing to come in and take the place of that aging population that may be in those rural areas. You see it in Appalachia, in California, you saw it in kind of what they call the high desert. You saw it in the Carolinas, kind of, different pockets of the Carolinas. So it's a huge impact on healthcare, a huge impact on the supply of healthcare providers. And what typically happens in healthcare is that supply starts to decrease. What's going to happen to you as a consumer? If you live in one of those rural areas, how long is it going to take you to get a doctor visit? How long is it going to take you to get the healthcare services that you need? So it is a significant issue, a significant problem, one the government constantly looks at. But I'm not sure the government at any one time has a remedy to increase the number of sellers. And again, it's the number of sellers of healthcare goods and services in some of those rural areas. That's going to wrap things up for this segment. And we've kind of gone through a number of these supply shifters. And I will be back. I think we've got one more segment maybe to go through. And then we'll kind of wrap up chapter 3. So I'll be back in a few minutes. We'll go through the last segment and we'll kind of, at least for this particular point in time, we'll kind of put chapter 3 to bed and move on to chapter 4. Talk to you soon. Thank you.